Welcome to the MedCenter Show. I'm Joe Scott, the President and CEO of Jersey City Medical Center. This week we have Barry Ostrowsky from Barnabas Health. As many of you know, we recently joined the Barnabas healthcare system. So we're going to talk about the future of healthcare in Hudson County and throughout New Jersey with Barry Ostrowsky, the President and CEO of Barnabas Health. We'll be right back.
Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state, #1 for high-risk pregnancy, #1 for neurological disorders, #1 for stroke, Magnet Award for nursing excellence, A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for nursing excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Welcome back. Joe Scott, President and CEO of Jersey City Medical Center. I'm here with Barry Ostrowsky. Barry, welcome.
Thank you, Joe.
We're so proud to be part of the Barnabas healthcare system. On June 1st, we actually became part of the largest healthcare system in New Jersey. Tell us a little bit about you, and you've been with Barnabas for a really long time.
Well, before I talk about me or the system, I want to congratulate you and your colleagues at Jersey City Medical Center. We're so delighted to have you as part of the family. Jersey City Medical Center has always distinguished itself as an incredible healthcare facility, committed to the needs of the people in all of Hudson County, of course. And so joining with the Barnabas Health System is something that's terrific for us, and we know it's going to be good for everyone. I've been with Barnabas Health for 23 years. Prior to that, I was a lawyer, so I'm a recovering attorney that's now in healthcare. Yeah, that's always difficult. And it was a single hospital at the time, and my predecessor and mentor, Ron Del Maro, and I decided that we thought it would make sense to build a system. And so over these couple of decades, we've built, as you've pointed out, the largest system in New Jersey, not-for-profit, dedicated to community service, dedicated to our employees. We're the second largest private employer in New Jersey. And we hold values that frankly are the same values and culture of Jersey City Medical Center, which is why I think this is a wonderful fit. Healthcare is changing dramatically. We think you need a certain size and scope to effectively navigate those waters, and we look forward to doing that as partners.
So when we look at New Jersey and it seems like every time we turn around, somebody else is talking to somebody else.
That's right.
We think that there's going to be huge consolidation.
I think there will be. Obviously, we've been a consolidator. Right. I think if you were to fast forward 3 to 5 years, there'll probably be at most a half a dozen systems in New Jersey.
Right.
Frankly, I think hospitals who try to go alone, except for the very big ones, are going to be an endangered species. Not because they don't mean to do well, simply the environment, the economics, the approach to healthcare is requiring that there be partnerships and systems. So as you point out, I think New Jersey will be dominated by healthcare systems, and we expect to be a leader in that regard.
Right. You know, so when we started looking at Jersey City, even though we've done some great things at the medical center, we recognized pretty early on in discussions with our board that it was going to be really difficult for us to be a standalone facility. Just healthcare reform, population health management, all those things that are going to require significant infrastructure were problematic for us. You've actually started working on many of those initiatives throughout Barnabas.
Correct. I think, as you point out, you need a certain size of platform to accomplish the goals that you want, both clinically, managerially, financially. So from a managerial standpoint and from a financial standpoint, the economies of scale of a system, understanding how we're now going to have to control premiums and take at-risk contracts with third-party payers, how we need to respond to the Medicare program by adopting population health. Those are all things very difficult to do if you're a standalone institution. On the clinical side, I think in order to adopt and make available the latest techniques requiring the latest technology, you need, again, a system so that you can share the expense of recruiting most finely trained clinicians.
Right.
And so our view was if you create a system, you're able to do better clinical work, you're better able to have the economies of scale, and you're better able to face the economics of the new healthcare delivery system, which are going to be dramatically different than the systems in which you and I grew up.
Right. You know, it's interesting to say that. I just got an email this morning from somebody who was evaluating our supply chain, looking at different contracts and how we might be able to save money. And just on our pharmacy distribution system for inpatients at the hospital, we're going to save $400,000 a year by joining the Barnabas Health system. So, I mean, that's, you know, it's already starting to happen so quickly. So we anticipate those kinds of savings just from joining your system.
And I think that's what's great about it.
Yeah.
I think most of us who have grown up in healthcare over the last number of decades realize our focus has always been on the clinical care, and it's always been on supporting our communities, and perhaps we didn't pay enough attention to the conventional business aspects of running a big enterprise, which we've become, and now more than ever that's important. So the savings that you just recited are critical, and they should be replicated in a series of services that each of us needs. And so when we buy it together, when we manage it together, it's going to be a source of greater efficiency.
You know, we talked also about recruiting physicians. The medical center at one point had a pediatric intensive care unit, struggled really financially at the time, and wasn't able to provide all the pediatric subspecialty. You know, we've already talked to Newark Beth about bringing some of their pediatric subspecialists into Hudson County. And there, again, an opportunity for us to kind of expand clinical services without really expending a whole lot of money.
And that's exactly right. And I think as a system, there probably will not be a specialty, a subspecialty, a narrow specialty into which we can't recruit, because we'll now have significant populations, many venues, Jersey City and Hudson County, of course, being one of them, where these physicians can be deployed to the benefit of the communities. Standalone hospital, it's a very difficult thing to accomplish. And quite frankly, the best trained physicians in these specialties want to have a sufficient base of patients so they can remain active. I mean, I'm saying all things that you've known throughout your career.
Absolutely.
You've built systems, you've built Magnificent Hospital, so that it's now the reality of what we do. The ego that drove hospitals to want to be individual and frankly not cooperate is no longer a productive feeling in the healthcare world.
You know, one of the things I was most impressed with when we started talking to you about becoming part of the Barnabas Health system is really your dedication to the community. I mean, that was so well aligned with what we have been trying to do over the last 5 or 6 years. I mean, that really is one of the pillars of what you're trying to
Absolutely.
accomplish.
I mean, and that's what made our mutual culture so compatible. You know, it's funny, I've always seen us in the social service business. Our number one product line has been healthcare. But when you look at all the skill sets that our professionals have in our system, you realize that they're available to help people when they're not sick. And that's a community of people. So how can we mobilize these wonderful people that work for us to help the community before they show up at the emergency department, before they get sick? So it's always been our focus to try to do that. One of the obstacles is it takes a lot of resources, and the finances of healthcare were never really accommodating to that. But our view is we're a community resource, no matter how big we are. We're a community resource, and we need to be able to support our community, and that's the integration we seek.
This is really exciting. We're going to be right back. We're going to talk a little bit about some of the expansion opportunities, maybe some oncology, and again about some of the community initiatives that we're going to be working on to really support Jersey City and Hudson County. We'll be right back.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back. We're here with Barry Ostrowsky, the President and CEO of our new organization, Barnabas Health. Jersey City is proud to be a member of Barnabas.
love having
We're
you.
really, really excited about it.
Same here.
You know, one of the things we've been talking about is the future of healthcare and really how we're going to manage patient populations. And so at Jersey City, we started looking at ambulatory sites to see if we can't really provide care for patients in the best venue possible. The hospital is always the most expensive venue of care. I know that that's been one of the areas that you have also focused on. Any thoughts about, you know, really expanding services in the outpatient setting?
Sure. I think you're right, Joe. One of the principal elements of the strategy for Barnabas Health is to diversify away from the reliance on inpatients. You know all too well that the demand for inpatient care nationwide is dropping, and that's in part a tribute to the latest technologies and to the incredible new techniques for treating patients. So to force patients to be inpatients or to force them to come to big buildings is not particularly supportive of patient satisfaction and frankly is inefficient. Many years ago at Barnabas Health, we developed big outpatient campuses. We have one in Livingston, New Jersey that's 240,000 square feet.
Wow.
And it's a collection of great outpatients. It was an interesting development. Rather than use a healthcare architect to plan it, we brought in a resort architect.
Really?
Because
Wow.
we wanted the feel of something other than a plain vanilla healthcare facility.
Right.
And it's been wildly successful. In fact, we're adding 40,000 square feet starting in a couple of months. So we believe very much that if we're going to be a successful healthcare system, let's get out into the community, let's make the venues accessible to members of the community, and let's not drive them into what frequently is a difficult place to navigate no matter how good your hospital is.
Right.
We anticipate doing the same thing, of course, in Hudson County,
Right.
leveraging off of the great reputation of Jersey City Medical Center to have multiple sites in the community so that the outpatient care can be rendered in that way.
You know, it's interesting you say that. So we evaluated our emergency department, and, you know, our ER can get very crowded at times.
Right.
And about 30,000 patients come to our ER that we think really don't need to be there. And so we're looking at a couple different sites. We're talking about the Greenville Hospital. You know,
Sure.
We've talked about that in terms of providing urgent care services. About 10 to 15,000 patients come from Greenville to our emergency department. If we had something that we could provide for them locally, they wouldn't really have to come to our ER. So that convenient, accessible, ambulatory process, I think, is what we really need to focus on.
I think so too, and I think
Yeah.
that's what people want.
Yeah.
I mean, you're a trauma center at Jersey
Right.
City Medical Center,
Right.
so for 20 years you've dealt with the worst cases and of course have a great history of treating those patients, and it's
Right.
only natural that a lot of attention is going to be paid to the traumatic type of injuries that come in that regard. For folks who have something far less than that, want immediate attention, but candidly are going to have to be put in a queue in a comprehensive emergency department, it's certainly better in our view to have them treated in an urgent care center.
Right.
The future of healthcare is going to be non-appointment healthcare.
Right.
So if there's a venue where a patient can come, irrespective of how acute the need is, and sit there and get some access to a clinician, I think that's really what's going to make us successful.
Sure.
So your notion of urgent care and unscheduled care
Right.
in the ambulatory settings is really what we need to pursue.
You know, it's interesting because we also looked at women's health with all these young folks moving into Jersey City.
Sure.
Even with, when we did our community needs assessment, one of the things that popped out is that cervical cancer is a big issue for our community. And so, like Barnabas, we identified that as an issue, and now we have a women's center that we're going to be opening at Grove Street.
That's right.
Again, it sounds like it's right in line with kind of what we're trying to
Perfectly consistent. Women's issues for Barnabas has always been at the top of the list.
Right.
We birth more babies as a system than in any other place. And our breast clinics are well known, and certainly the women's system that we've put together is perfectly compatible
Right.
with Jersey City Medical Center. On the cancer side, of course, we think there's great opportunity at Jersey City Medical Center to develop a comprehensive cancer center,
Right.
using again some of the clinical strength that we have, using the reputation of Jersey City Medical Center. If you put that together, you're going to have a clinical service that will attract those who live in the communities and, by the way, address the needs.
Right.
And as we become more sophisticated in evaluation and diagnosis, we're going to find more cases,
Right.
and then you have to be able to do something about them.
Sure.
So we're very excited about that possibility.
You know, so two things. One, talk about physicians. So we never had fertility specialists on our campus,
Right.
and the fertility specialists from Barnabas are coming over,
Yep.
and they're actually opening in our medical office building.
Right.
Something the community has been asking us for
Sure.
a long time. So right away, again, there's a great opportunity for us to expand services and offer that to our residents here. The other is GYN oncology. We didn't really have a GYN oncologist, and we're actually talking to St. Barnabas to have their physicians come over and work with us for GYN oncology. So again, that's what this is all about, really
That
being
is what
able
it's
to
all
enhance
about.
our services and really borrow from a lot of what Barnabas is already doing.
Yeah, and those happen to be two services where we were pioneers.
Right.
Long before I got there, we started in that regard, and they've been welcomed by the communities that we serve. I think this is frankly the successful equation. Go to the community, find out what it wants, find out how best to deliver it, and then maximize the resources that a big system has in order to meet those needs. Because in order for a standalone hospital to meet those needs, it's very difficult. The
Very, very
resources
hard.
don't exist.
Right.
And here we can be very creative as to how, where, when we deliver it, including offering education to the community from well-known clinicians. These are the things we think, and you've proven, upgrade the good feeling of a community. It's all about trying to make people feel better in everyday life.
No question, right.
And so that's what we're trying to do.
So that's all that life is better healthy, right?
There you go. Life is better health.
See that?
You know, and of course we always say if we keep everybody healthy,
Yes.
we're going to better find a business
That's
plan
exactly
to keep us
right.
alive. You know,
Well,
so
maybe
it's
that law degree comes in. I used to be a pharmacist, so
exactly.
I guess I could go back.
I
to
could
dispensing
default to
drugs.
that if it's required.
Although I do think I need a little more training in order to do that. You know, so talking about oncology, 65% of the patients with insurance leave Hudson County for cancer care.
Yeah.
A huge opportunity for us.
It really is. When we studied the demographics and the migration patterns, and we've seen this in other places in New Jersey. I mean, we know for many years that there was always an outward migration attracted by some of the big hospitals in New York and Philadelphia and elsewhere. And little by little, we tried to construct alternatives and prove to the people who live in New Jersey that you don't have to travel outside of New Jersey to get this kind of care.
Right.
I think the change in population in Hudson County is striking. There's a very sophisticated new residency in
Right.
Hudson County who are going to want the best. And so we don't want to fool anybody. We want to develop a clinical service that will speak for itself, and then people will, in fact, we think, remain in Hudson County. We'll make it convenient, we'll make it excellent. And again, I've been saying this, starting with the Jersey City Medical Center platform, which is a trusted name in healthcare and a trusted name in community service. I think a comprehensive cancer, both clinic, center, and service will be wildly successful in reversing that migration to New York.
Yeah, for sure. We'll be right back. We're going to talk more about expansion at Jersey City Medical Center.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Barry Ostrowsky, the President and CEO of Barnabas Health, our new partner at Jersey City Medical Center. Barry, we were talking a little bit about comprehensive cancer, developing a comprehensive cancer center. Unfortunately, when the medical center was in kind of financial straits, the decision was made not to really provide cancer services. We did a little bit, but really not in a comprehensive way. 65% of the patients leave Hudson County for oncology services. We're looking at a plan for really providing world-class cancer care right on our campus.
Well, I think that's the plan we have to pursue, and we're anxious to do it.
Right.
In our system, we're very fortunate. We have some incredible oncologists, both medical and surgical, radiation oncology, so we do have the full spectrum of appropriate cancer care. I think in today's world, there are many more subspecialties in cancer than ever before, and if we're going to reverse that migratory track, we're going to have to produce those great subspecialists. Building on what we have at Barnabas Health and adding it to Jersey City Medical Center is truly one of the goals of this partnership.
Right.
So we're very anxious. As you know, we're already planning where it should be, how we could do it, when it should open.
Right.
And the one thing I think we both know is if we're going to go to the community and say, you should stay here to get top-notch care, we have to deliver on that promise.
No
So
question.
it can't simply be an ad or a title or a name on a door. We've, over the years, gone out of our way to recruit some of the great subspecialists in cancer care, and we can't wait to recruit more, place them at the Jersey City Medical Center site,
Right.
have them rotate through, and make for a seamless, comprehensive cancer center.
Since we've only started June 1st, but since then, we've actually brought with you a consultant in to take a look at the hospital, what our bed complement is, what's happening in Jersey City in terms of population growth, how we might be able to develop this comprehensive cancer center, whether or not we need a new medical office building, really the growth of healthcare in Hudson
Sure.
County. And we're very fortunate we have all the space on our campus to be able to do that. I mean, that's really thanks to you guys. We've been able to really start that planning process, which we really wouldn't have been able to do as a standalone.
Well, we're delighted with that. And when you look at the Jersey City Medical Center campus, what you see is a healthcare campus that will be a big destination.
Right.
I mean, what you really have to do is build a destination campus, and you've already started on that. I think adding a medical office building, adding more ambulatory space, making some of the additional accommodations for people who come to the campus, all of that will work very well, particularly when we also open up some off-campus centers, which will help the people navigate their care and what they need and bring them back to the campus if necessary. But the Jersey City Medical Center campus is an outstanding opportunity to introduce any level of care, particularly the subspecialty care.
Sure.
I think what we're going to find is there's going to be a serious demand for Jersey City Medical Center inpatient care because, frankly, in Hudson County, Jersey City Medical Center is it. And so we're proud of that fact.
Right.
We just have to make sure we use it efficiently.
Yeah, you say that because we're the trauma center, we have the level 3 NICU, we really provide the high-level care
Cardiac
for
surgical program, that is outstanding. So you have the services at Jersey City Medical Center that define, in our view, what a comprehensive medical center should be. It's not just a name. You have it. And when we expand some of these other clinical programs and make them connect to the ones you have there, this campus will be a great destination.
I mean, think about it. We add cancer to the existing services, and we really have a comprehensive program, and really a tertiary program for our area.
Sure. And you're a teaching institution. We are a big believer in teaching. You can't be a great health without a commitment to graduate medical education. And Jersey City Medical Center has had that as long as any facility in New Jersey.
For sure.
So that's all part of the culture that
Right.
we admire.
Yeah. It's interesting because we've been talking to Clara Moss, and we're talking about as our residents graduate, hey, maybe we can feed some of them over to Clara Moss. That's part of that. That's the great thing about working as a system. It really is. You know, one of the big controversial issues, and then we're going to close on this, is our EMS contract.
Really?
I'm sure everybody in the city knows that it went out to bid.
Right.
We've been doing it for 130 years. We're the best provider of EMS services in, if not the state, in the country. We have the best response times. We have a really comprehensive quality program that really focuses on getting patients to the hospital as quickly as possible. Any thoughts on
Well, I have to tell you,
EMS?
Joe,
Yeah.
in the last 20 some odd years, our system has been in and out of
Right.
the ambulance business. We have watched from afar as your EMS system continues to pick up accolades nationally.
Right.
The data speaks for itself.
Yeah.
You know, people throw around the term world class,
Right.
frankly, with too much casual notion.
Sure.
This is a world class community-focused service.
Right.
Let's forget for the moment the politics and the bidding,
Right.
but when you look at the service that's provided, the people of Jersey City deserve to have this world-class service. So whatever has to be done in order to support it, we're in favor of doing it.
Sure.
This isn't about building a new service. This is about maintaining something that's already attained the platinum standard for delivering care to folks. So when the controversy is over,
Right.
the people of Jersey City deserve to have the best service, and frankly, Jersey City Medical Center has had that for years.
Yeah. You know, it's interesting you say that because we spent a lot of time and effort really honing down on how best do we respond in a pretty densely populated area.
Absolutely.
You know, how do we get to people as quickly as we can when they really need emergency medical services? And by putting those ambulances out in the community and focusing on response times that way, we really have been able to make significant improvements.
Well, I congratulate you and your colleagues on that. It's been wonderful, and as I say, we are anxious to join it.
Right.
Because I think it sets the standard for EMS care.
Yeah. Yeah, so we'll see what happens. I guess the contract's coming out soon, and
Yeah.
we'll see kind of how this all plays out. You know, there was some talk about splitting the city. I think nothing is worse than splitting the city, right? I mean, how can you even coordinate care? That becomes
Exactly.
really difficult.
And I think anything that weakens an already, let's not try to fix something that isn't broken.
Yeah.
And so whatever the creativity is around how it's going to be done,
Right.
I think we ought to start and finish with the fact that when you have something that's as good as it gets,
Yeah.
why tamper with it? And I think the people of Jersey City deserve that, and that's why we're so excited. I expect it'll come out the right way.
I agree. Well, listen, thanks for being on
My
today.
pleasure.
It was,
Look forward to being your
yeah,
partner.
You know what? We're really looking forward to it. You know, as I said, when we started looking at who our best partner was, hands down, we're so happy to be part of the Barnabas Healthcare system.
Well, we're delighted.
Thank you.
Thanks, Joe.
Appreciate it.
Same here.
And thank you all for being here this week. And thanks, Barry, for coming.
Our pleasure.